So one can look at disparities from the perspective of business imperative, economic imperative on the one hand, moral imperative on the other. Certainly, there is an obligation to be efficient. We don't have unlimited resources, and so if we use our resources wisely, we can help more people. But then there's a decision to be made at every moment. How much will we give? Will we give till it hurts? And that's where the moral imperative comes in. Well, the decision regarding how much to spend is never a single decision, right? It's the accumulation of many individual decisions, some made for rational reasons, some made for irrational reasons. If you look at the healthcare spending in the United States on something like breast cancer, it's much in excess of the individuals suffering from cancer. Okay? There are other illnesses that are exacting a much greater toll on the American populace, but breast cancer draws at a heartstring, so it gets more funding. So there are some things that make sense, some things that don't make sense. When you sum them all together, though, you have some barometer of how much a society values a certain commodity. What are we willing to tolerate? In the US, we're willing to tolerate 17.9% of our GDP going to healthcare. We think it's important. There are other countries that have looked at their position in the Human Development Index, and they felt that their country was not doing well, and they made a decision, a political decision, to increase their spending. And they moved up much more dramatically than their economic growth would have normally allowed them. That's a function of political will. They decided to take funds in other areas and apply them to public health, to the general welfare.